see the current practice throughout the UAE, not only UAE, through the GCC countries, the asthma management is very far below the standards of standards practice. It is being evidenced, it is not only my point of view, it is an evidence from many studies, that urgent studies and the asthma control studies throughout the GCC countries like Oman, UAE and other places. So the asthma control is very far from the standards or the reported what is expected, like GINA guidelines or expert panel review 3. So, but though some of the stakeholders take the initiatives like Saudi and Health Authority, Abu Dhabi and Dubai Health Authority, they do some initiatives to make the level of the control the asthma in the community of the respective countries. But still, in my opinion, they have to do more to curb or to control the asthma in this region. The challenges, what are the challenges we asked, right? So the challenges is to controlling asthma is that the main thing is the education, spreading the education through the community to the patients, and also this education is not proper, and also a pharmacist or the practitioner should make a partnership with the patients to curb the asthma management. It is not only just giving a service and say okay. It is, we have to educate the patients and make them involved in the management of their own asthma. Asthma is nothing but talking to the patients and taking the histories and making involve them in their self-management of asthma. And another challenge is that lack of pharmacist time actually. The pharmacist time with the patients are very less, and also the patient time also very less to spend with the pharmacist. So both of them, the pharmacist always busy at the counter or dealing with the patients. There should be a specialized pharmacist, should have take a minimum time of 15 minutes with each patient to give attention, to educate, or how to use the inhaler techniques. All those things we have to have the time with the patients. That is another importance. And improper guidelines are available. There is not much guidelines for the available locally. Though HAD has some initiative in 2012, they established the guidelines for the management of asthma in childhood. But it is not, it should be followed by the GINA guidelines, and it should be prepared according to the local culture and socio-economic factors, and it should be established here. So these are the challenges I face. Yeah, that's what, there's a development, there are some initiatives only. Not like, but if I can see from the HAD, they have initiatives to control the asthma. As I said before, in 2012, the HAD have developed control of asthma management, guidelines about management of asthma in the childhood. But whereas if you see in the Saudi, they have Saudi Initiative for Asthma. Saudi Initiative for Asthma, which is more or less same as the Global Initiative for Asthma, which is following the global guideline and made it according to the local perspective. So such initiative, the UAE also should take it, or other Gulf countries also should take it, and to spread the knowledge among the practitioners as well as the patients, so that it is one of the factors which influence the control of asthma. That's what my idea. Challenges is that how to overcome, we have to put the solution for that. So solution is that develop a national guideline. As I said, the national guidelines for throughout the UAE, develop a guidelines and implement into the different hospital. It's supposed to be started from the government hospital, and even from the private hospitals, they can follow the same guidelines and it's implemented. That's another one. And create the awareness among the school children, because more and more children are suffering in the UAE. So create awareness in the school children the community and the practitioners, either it may be a pharmacist or a doctor. So to create awareness to them also. And to develop asthma educator pharmacists, asthma educator or specialized pharmacists who involved in dealing with the patients. So first of all, we need to develop a specialized pharmacist and then make them available to the patients to help them. And if you give a specialized service to the patients, a pharmaceutical service or medication management services for the asthma patients, the pharmacist should be paid well. Regarding the remuneration is an important factor. The pharmacist may spend 15 minutes or 20 minutes. It's a quality time, which is definitely going to impact the health of the patient. So these remunerations has to be paid by the stakeholder, like hospital or where he is working, or by the insurance. In my opinion, the insurance company should have the initiatives to cover the pharmacist service and paid well for their services. If the insurance company started these initiatives, so then pharmacists are happy to provide the services, and it's one of the area they can concentrate, and it's one way to give education to the patient. Yesterday I discussed about the challenges what the pharmacists face while delivering the care to the patients. It's not only here, throughout the world the pharmacist or the practice is the four main areas they have to concentrate. The first thing is that educating the patients, about the medicine, about the asthma, and make them involved in their self-management. Second thing is the inhalation techniques. The improper inhalation technique is the other cause. So if the medication is prescribed and the patient doesn't know how to use it, and that obviously it will not going to help. The patient will not be benefited from the medications. So inhaler technique is very important, and whether it may be any inhaler, maybe a discus or hand inhaler, whatever it is, because not like other diseases, but asthma is mostly deal with instruments like tools, like meter dose inhaler, all these things. So these things require some techniques. That techniques needed to be deliver the medications correctly to the patients. Then only the patient is benefited from the medication. So these are the challenges, and the overutilization of salbutamol, like this short-acting beta agonist, are not using control of medications properly, and the poor adherence to the medication. So these are the key points we discussed yesterday. It is definitely a very informative congress actually, where the congress have the very different experts from the different field of pharmacy. They invited many people from the speakers from many countries, and even attendees' expectations also high. And definitely it is informative, and it bring a new idea and sharing new ideas between the pharmacists or between the expert and the learners or the young pharmacist. So definitely it is a good one, and I recommend that Marefa management should continue organizing this one every year, and should bring good speakers internationally or locally who have expert in this field, so that we can share the ideas and the knowledge between pharmacists and pharmacists. Yeah, I think most of the things in my mind I shared with you. It is good actually. It is good. Nice congress it is. It's a very very good organized.